Hey, welcome back to our podcast, Project Brightside, where we always look on the bright side, even when things are looking pretty dark. I'm Dr. Shelby.
And I'm Richard Brito, and we're your hosts for today's episode.
Topics of discussion for our podcast include society and culture, education, and TV and film.
Each episode of Season 2 will have an interview of a guest speaker, followed by a Bright Talk segment where we discuss a complicated topic in hopes of shining light on it.
For today's episode, we'll be interviewing Dr. Shivani Arza. Hi, welcome to our show. How are you doing today?
I'm doing great. Thanks for having me.
So, to start us off, tell us a little bit about yourself and what you've been up to professionally in the last year.
Yeah, totally. So I'm currently a second year resident in obstetrics and gynecology. So I have been working through the transition of going from a medical student to becoming a resident and going through all the different rotations and figuring out what I want to do with the rest of my life.
That's awesome. And I know that's a lot of pressure and stakes having to decide something that you want to do for the rest of your life, in terms of specialties in the medical field. So, but I applaud you for going through it and having the willpower to actually face it all.
Yeah, it's definitely overwhelming, and I think it really makes you reflect on what's important to you and, what will also fulfill you throughout your whole life. So it's big, but it's exciting as well.
So, can you share some examples of obstacles you've faced?
Yeah, totally. I think throughout the entire journey of medicine, there's a lot of different obstacles, whether that be, you know, like things like board exams and like trying to meet the marks on those type of things, and even like difficult patient situations. I think as somebody who didn't have any family members or anyone in medicine, I think figuring out that journey was challenging for me to, know what to do, who to talk to. Medicine is similar to a lot of the other fields in that who you know can kind of really help you, but sometimes you just got to figure it out on your own. So that can be a little challenging. But I think also one of the biggest challenges this year for me has been having tough patient outcomes and navigating the the like feelings after.
Hmm.
I think going back to work after a tough situation was a lot harder than I initially anticipated. I think we oftentimes in medicine put things into boxes and kind of move on. And when it's little things, we tend to unfortunately do it pretty well.
True.
But when it's larger, more significant events, it can really weigh on you. So I think having a good support system is definitely important, having good mentors. But I am grateful that things, have happened to me and have happened to my patients while I'm still in training to, have those mentors and have to be able to talk to other people to see how they deal with it. Because it is unfortunately a part of medicine.
Yeah, and thank you for sharing all of that. And it really does point out how critical it could get, and life and death, and um, anything that could come unexpected, and that unexpected could be scary because it could be a whole spectrum of whether the simplest procedures to the most difficult, and the outcomes could be, things that could be simple treatments, or it could just lead to death. And weighing that and seeing what happens in real time, I applaud doctors. I applaud people putting themselves in situations to help others. So, I really appreciate you sharing this. It is difficult, to do all of this as humans, and people are put into these positions to make a difference, and you have to be able to navigate those emotions. And it's a learning experience. I feel like you'll never stop learning as a doctor, but it will get better. You will be more qualified. And I'm just grateful that you're sharing this, and you're sharing, how difficult it can be, but how impressive you are, because we know you're impressive.
Thank you. Yeah, one of my mentors, when I, was sharing with her how I was feeling, she was like reminding me, she's like, it's brave for you to do medicine. And I had never thought of medicine as being something that like I've never described myself as brave for wanting to be a doctor. It was always like, oh, I had like the drive, the ambition, the endurance, whatever, but I never saw it as like brave. So I think
Mhm.
that was a unique perspective on the occupation.
Yeah, that is unique for sure. I think something else that can be challenging in medicine, is I think it draws a lot of people who are kind of type A personalities, or even if we're like more type B, we have a little bit of type A in us, and I
Hmm.
think we like control. And so, whether we admit that or not, and not in the sense that we're controlling like our patients by any means, but in the sense that we like to kind of be our best at all times and like to know everything that we can know and to perform like at the best in the best possible way. And so I think when there's bad outcomes, even if it had nothing to do with our performance or it had nothing to do with how much we knew and it just happened, I think that can take a really big toll in questioning, well, is there something else I could have done? Because it
Yeah.
takes that control out of the situation. And ultimately, we're there to do our best and to guide people, but it kind of hits you with that reality that you're not in control.
I could totally see that, and reassuring, like making sure that you're pouring into your cup. I heard that the other day from my friend Ashley. Making sure that you're keeping up with yourself and the energies and things that you experience, that you're able to clear that out, and you don't carry that with you, and you learn from it and grow.
Yeah, absolutely. I guess kind of moving forward from that, and you touched on this a little bit, but you mentioned how important it is to figure out the things that drive you and that kind of give meaning to your life. What sorts of things do drive you? That can be professionally or it can be personally.
Yeah, absolutely. I think what drives me is mostly like I just want to, like, to put it plain and simple, I just want to be a good doctor. I want to be someone who advocates for my patient and is knowledgeable and keeps up with either the most up and coming things in medicine. Unfortunately, I feel like OBGYN in the recent years has gotten a little bit of a bad rap, whether
Mhm.
that be for, I've seen things about like not taking women's pain seriously, or, like not like minimizing procedures, et cetera, et cetera. And it's unfortunate because I mean, OBGYN does have a poor history of how to like taking care of women, historically. So I feel like as an OBGYN now, I have some duty to try to turn that around. And that's creating an open and honest discussion with my patients and making them feel as comfortable as I can. Unfortunately, OB-GYN can be a field in which it's very, personal things that we are dealing with. There's no way to do, unfortunately, a speculum exam without it being an invasive. It is an invasive procedure, but I think as OB/GYNs, we need to acknowledge that and ensure that our patients are comfortable during that process. So that's just one example, but I think that's something that keeps me going is that I like hear people's experiences, and I want them to have a different experience when they're coming to see me. And sometimes that's out of your control, unfortunately, but as much as I would like to, I want to provide, you know, good care for my patients so that they feel comfortable and empowered in taking care of themselves and their health.
Yeah, but beautifully said. I agree with everything you're saying. Doctors should, aspire to follow, similar perspectives, because what you're saying is truthful, but it's also informative. And it's not, you articulate things in a way that is very professional, but very, very honest. And you said about, creating an environment where you're able to navigate and turn things around in a way that benefits your patient. Because at the end of the day, you're a provider and you're trying to improve other people's lives, intervene, provide treatment, especially with the political culture. I don't want to dive too deep into it, but I know that OBGYN has received a lot of negative attention with policies, and it's been conflicting in different states. And, the only reason that I bring this up is because in the United States, there's a high mortality rate. So it's very important to present, all the options to the patient. And I'm sure that you could explain this way better than I. So I would like to turn this topic over to you and any insights that you might want to share in regards to, how you navigate presenting the options to people, regardless. of your political, affiliation or any of that, because you have to remain neutral. And that's what sometimes people forget, that in medicine, doctors have this neutrality. Same thing with law, same thing, and, in different environments.
Yeah, totally. I think politics shouldn't have a place in healthcare. Unfortunately, it does in the US, but I think as a physician, your job is to present your patients with all the options, regardless on if you are able to perform procedures or not. I think the elephant in the room right now is we're talking about procedures like terminations,
Hmm.
dilate D&Es, D&Cs. And oftentimes, unfortunately, even throughout residency, not all residency programs are able to fully train their residents on these procedures because of where these residency programs and things are. So,
Hmm.
there are people who graduate residency where they've had some exposure to it, but may not feel totally comfortable with these procedures. And that's fine. That's totally fine. But I think if you have a patient who, for whatever reason, requires or desires one of these procedures, your job as the physician is to at least provide them with the option so that they're able to make that own decision, even if you're not able to perform that procedure yourself. I think it's a very complex scenario right now because I think, unfortunately, the terminology that's being used in legislation isn't necessarily the same terminology that's used in medicine. So it's left things very vague and ambiguous for providers in medicine. So I think that's why it's been so dangerous because, if they're saying you can't do this, but technically this is a life-saving procedure, it's like, well, do we do it then? Like when is it allowed? When is it not allowed? And that it creates really a dangerous situation. It's unfortunate that as a physician, my job isn't just to be like, oh, I'm doing what's best for my patient. It's like, oh, is what I'm doing legal?
Hmm.
I think it's weird to think that way, where it's like you don't, in medicine you're taught to do no harm, but it's like, well, I'm kind of my hands are tied in this scenario. So it's challenging. I fortunately am training in a place where we're able to learn how to do all of these type of procedures and are able to provide that type of care, and I'm really grateful for it because I think, it's something that I can't take for granted because we can't get all this training everywhere. We really can't.
Yeah,
Yeah.
beautifully said. Thank you so much for sharing that.
Yeah, I think it's all of that was important, but I think especially the part about trying to not only navigate but also understand the law. Like we already have a pretty tough job, and so
Hmm.
I've heard of like I think it's in Texas, right? That like if you aid like someone in getting an abortion, you can be like criminally prosecuted. And so what does that mean? Like what level of guidance is aiding? And I think that's a challenging thing. And I think it's making a lot of providers scared to counsel at all, like in any regards. And so, I mean, you hear terrible stories, of course, but something that's a shame in the family medicine field as well. So I guess kind of moving on from there, and I know we're kind of shifting gears a little bit. That's a big topic, but what do you think some of your biggest priorities are before 2024 ends?
I think for me, it's like professionally, I think the transition from like medical school to residency is different because I feel like at least for me, good or bad, I felt like I was studying for the test in medical school where like it's very like you're in your cardiology block. Okay, you're studying cardiology, take your cardiology exam. Okay, now you're studying for your pulmonology exam and et cetera, et cetera. But in residency, you're studying basically for the rest of your life in a way. You're not just studying for a test, you're studying to be able to take care of your patients. And I think initially when I started residency, my intern year, it was kind of just surviving. It was just like getting day to day, learning how to put in orders, learning how to like, the correct doses of the medicines, etc. Um, but now, I feel comfortable with those type of things. So it's now coming up to the next level of it. It's like, okay, yeah, I maybe know all about this topic, but what's the latest research on it? What's new? What's the up and coming? I think I do have a duty to like learn about those things at this point, especially with all the mentors and teachers around to be able to like have to learn something, be able to discuss it with them, why they do what they do, how are things done differently. I think it's a great opportunity at this point in my training to do that. And that's something I definitely want to, take advantage of because I think I'm past the initial, like, I just need to learn how to do the things, the day-to-day things. It's now taking it to the next level. So that's something I definitely want to take advantage of.
I love how driven you are. I love the adaptation that you're mentioning. There is a trial and error and having to learn from your mistakes, and that you've gone through that with medical school in terms of getting tested and being put under pressure. But now that was a controlled environment. Now you're in the real world and anything could happen. So you mentioning that pressure of having to constantly study, and it could feel a little overwhelming, but in a way it's you being the best of the best, you being aware of everything that's out there. You just have to have an organized, disciplined way of tackling it, and I'm sure you do. And you've been able to get it, excuse me, you've been able to make it this far. Looking back, you said that you're the first in your family to pursue medicine like this, to be a doctor, and you're making groundbreaking moves in your ancestry. So like that's exciting, and I'm proud of you. You're noticing how brave you are, and because you never looked at medicine in a brave aspect. But I just wanted to share that because that's how I felt like hearing you speak about like the difficult decisions you have to make. And I'm sure Shelby goes through it too, but with OBGYN it might be on a more intense feeling that you're getting back to back, especially with like the higher cases of mortality that they're uh right now existing. But anyways, back to the focus. How do you see yourself evolving and growing in the next year?
Yeah, I think it's kind of similar to how I mentioned, kind of taking it to the next level. It's interesting because in our program, um, first and second year, you're doing the different tasks, but by the time you're a third year resident, you're serving as the chief of the service. So you're like in charge, basically. So I think that's going to be a big change. It's going to be scary to be in that position with that next level of responsibility. Of course, there's still like an attending, a supervising doctor who's overseeing everything, but you kind of need to like be willing to take on that responsibility and kind of get comfortable with being uncomfortable. And it's one of those things where you're thrown into it and you just kind of have to roll with the punches. You're not always going to be making the right decision. And I think that's something I need to realize and learn that, sometimes you just have to make a decision and it may not always be the right one. And sometimes you just got to live with it being the wrong one if it isn't the correct decision. So I think it's going to be a lot of growth from that aspect of new roles and responsibilities and, you know, taking the next step.
That's exciting. Something that came to mind is, enjoying the journey because
Mhm.
you do have so many steps ahead of you, and it might feel like, oh, I just want to be at that peak point where, you're at the top of the food chain and you're making those decisions, and you put that pressure on yourself and you're good with it and it feels, great. But that's an ideal, and take that the ideal is the future, something we're aspiring to. So we should enjoy step by step, chapter by chapter, and you have so many beautiful chapters ahead of you too, and you've passed so many difficult chapters. I'm sure that you're great, that you're very happy that you've been able to accomplish.
In family medicine, at least at my program, we start having chief days, like not being fully in control of the service all the time, but having days where we're in charge. And I think it is really it is really spooky, but I think at the same time it's cool because you realize that you're more prepared than you think you are. And I think that's been something that's kind of been encouraging as well, where I went into it being like, oh my gosh, what am I gonna do? And it's kind of cool when you're like put to your own devices to see yourself like rise to the occasion, even if you're not doing everything perfect. Like, of course, we're not going to do everything perfect, but it's been, yeah, I guess encouraging to to feel like we can handle it a little bit better than we think we can.
Yeah, definitely fighting that imposter syndrome because you guys are doctors, you guys are already competent enough to save a life, but there's obviously an oversight and structure to, seniority in the medicine, and you guys are just climbing the ladder, but that doesn't make you any less competent. You're very competent in, achieving any of the procedures that you set your mind to. It's just that step-by-step learning process, which you all are doing. And it's very phenomenal work what you both do. Thank you for sharing.
Oh, thank you, Richard. So, we've talked a little bit about how you see yourself in the next year and what kind of general goals you have and how you'd like to grow. If we were to fast forward to like the next 5 years, so after residency, whether you pursue fellowship or not, where would you want to be? Like, where would you see yourself in 5 years or so?
At this point, I'm not considering fellowship. I'll probably go into general OBGYN. I have a particular interest in like PCOS, polycystic ovarian syndrome, and things like that. So I think being able to work with that patient population and trying to have a degree of like preventative medicine incorporated into OBGYN, I feel like it's like, what we do in OBGYN a lot is, and in medicine really is like dealing with the aftermath. You get diagnosed with diabetes and it's like, okay, now we're going to start the medicine and things like that to prevent the progression, etc. But, for example, patients that have PCOS are at increased risk of developing diabetes. So I think having those conversations early on, when someone gets diagnosed, saying, hey, this is something that you're at increased risk of. These are things that we can do to, mitigate that risk. I think those are the conversations that need to be had a little bit more. And that's something I would want to like do more really in my practice, trying to blend treatment as well as prevention.
Like, yeah, you're definitely merging, you're looking at both sides. You're looking at the public health prevention and you're looking at the treatment. That's awesome. You're OBGYN resident, second year. What advice would you offer to those who wish to pursue a career like yours?
I would say be sure in what you're pursuing because the journey isn't easy. And every day is hard, honestly. So I think you have to remind yourself why you're doing it. And if you went into it for the wrong reasons, I think it would be really challenging for someone. So I think, while in medicine, while in medical school, or even before coming to medical school, explore other options, explore other fields. Not because I'm saying don't do it. I'm saying just be sure that you do want to do it. And some like if you don't know anything else, then you won't know that this is why you're choosing what you're choosing. So I think have an open mind, and do ultimately what your heart tells you to do. A lot of people in my journey told me not to do OBGYN, and here I am. So I think it was honestly good to hear that from people because I think it really made me question if I wanted to do it or not. And ultimately I did, which is why I'm here. But it was definitely eye-opening to kind of think about things from a different perspective.
Yeah, sometimes people have to like challenge you or present the information for you to contemplate it and, lead to that preparation and action mode. I'm glad that you're an OBGYN. The first in your family to pursue medicine. And, you're gonna set your mark in history as a doctor. So that's awesome.
Thank you.
I think it's a good thing too, like you were saying, when I know I know when I was with you in medical school, so I know in the moment it's not a great thing when people are like, this is terrible, you shouldn't do it. But I think in a sense it's almost good, like you were saying, because it gives you a chance to commit to something. And so when you are in it and it is hard, you can go, no, I chose this. Like
Yeah.
I knew that this would be hard and I chose this, and you can kind of own that and remind yourself why you chose it, like the good things that made you pick it when you knew that it would be challenging. And so I almost like that, retrospectively that they warn you about all these different specialties. Family medicine is the same way with like documentation and that you won't get paid and all these other things. And so I think it's cool to, when you're having a tough moment, to look back and go, you know what, I I knew these things would be a challenge and I picked it anyway, and here's why.
Yeah, and also a reminder, you know, you may have many years ahead to still go, but you're almost done. You've done the majority. It's residency is the hardest part, I feel. I mean, I'm not in it. You guys could attest to that or not if, there's a big
Find
difference.
out.
But
We don't know yet.
Apparently, the first 2 years of being an attending are very challenging.
I've heard
So
that.
I can
Yeah.
see that.
Yeah.
okay, never mind. You guys
Oh,
are in it. You guys are gonna do great though. Step at a time. Yes, it may, when you're an attending, you're in charge. Um, it's a new set of responsibilities. There's an adaptation phase, but in terms of knowledge, you'll be the attendings.
yeah.
So, it's just a learning curve for everything, but I'm proud of you both for sticking to it and showing dedication for so many years. That's actually so impressive and it just shows your willpower, your ability to commit to something and, go at it to your best ability.
Thank you. I think I think all the different areas so far have been challenging in different ways. And so I don't know. We can ask Shivani how she feels, but I don't necessarily, I mean, residency is really hard, but like I thought medical school was hard too. I thought applying to medical
Mhm.
school and not knowing if I would get in was hard. And so I don't necessarily think in my mind that residency is harder. I think probably objectively it is, but I think you grow and you continue to be able to handle challenges better. And so kind of evens out. Like it's just like
Yeah.
a
Like everything feels like the hardest thing when you're going through it.
Mhm.
Like I think before when applying to medical school, I think like the most like popular phrase is like, oh, getting into medical school is the hardest part, is what I often heard. And
Yeah.
then I got to medical school and I was like, this is hard, you know? And then you get into residency and then you're like, oh, this is hard, So it's just like one of those things where I think every step of the journey is hard, and that doesn't mean that we should diminish, oh, this is more hard than this, or like this journey is more hard than this. But like I think just appreciating it along the way, and giving yourself grace also along the way is important.
Mhm.
I often struggle doing that. Shelby knows I'm very hard on myself. So I think that's something that we need to constantly remind ourselves, that yeah, you got this far, you can keep going, but also give yourself grace because it is hard. It's a hard journey.
I mean, we were just talking today about like doing our first speculum exam on like a standardized patient, or like, oh gosh, like so like you just it's cool to look back and see how much you have learned, or like when you work with other learners that might be in medical school, or even like new interns. It's interesting to see like the difference that there is already in what even if it's just in terms of like how to put in orders or how to do
Yeah.
things, and to remind yourself that that was you a year ago, that like every year you're learning so much, and I think that's a real gift as well.
Yeah, I think also in like intern year, there's so many different learning curves. There's of course the education, the like, the knowledge piece of it, like knowing what meds to order for what conditions, etc. There's a learning curve of like navigating the computer systems and like putting in the orders and stuff like that, how to like post someone for surgery. There's also a learning curve of like working with others, really, working with your co-residents, working with your seniors, working with the nurses, working with the attendings. Like that is a new thing because as a medical student, you're just kind of behind the scenes and not really doing, the active management as much, but as a resident you are. So I think that's what makes like the first year of residency so hard, is that you're navigating multiple different learning curves. It's not just one thing.
Yeah.
Yeah, I can't even imagine, honestly. It sounds like a lot. Comparing it from, the opposite end instead of treatment. I mean, the only treatment I would do is mental health, but I don't wouldn't prescribe. Just a little bit of background. I'm trying to be a therapist, but I'm trying to also do many other hats. So I'm in my doctorate right now, my third year. I am facing the comp exam in 2025, which might be similar to like the exams you take
A
in your
step
second.
in.
Yeah. Yeah.
Yeah.
And after that, it's like, to me, it would be the easier parts of, finishing the program. But then come the decisions of like, oh, am I going to do a fellowship or a postdoc or Am I gonna finish my residency for so that I could be a licensed clinical social worker? It's just so many different options and so many different like learning curves that I'm gonna have to put myself through. Because I still want to accomplish like all of it. It's just having to pick. And I have to sort of like look at what residents do and what, the whole journey itself. And I try to like mimic it itself, like, not make it all at once and pace it out and show, that I could also follow a similar journey, but different. So that's kind of like where hearing what you guys are going through, it is a lot, having to be in those stressful situations. And if on top of that, you are not being like, engaging in self-care, it could really drain you. And I'm glad that you both are prioritizing taking care of yourselves because I thought my program was difficult, but what you guys are doing is extremely, extremely hard. You're putting yourself through the grunt work of saving a life, being there for people, in their worst. Some of the jobs that I would like be presented with is more leadership, like, administrative over a clinic, or um, if I were to put myself like through the therapy, I don't have to prescribe, I don't have to look over the interaction with drugs and, the side effects and stuff like that. It's just so many complex layers, and that just shows like you guys have developed yourselves into like a very like I don't know if hardiness is the word, but also compassionate and empathetic because you don't want to like be too distant. So every person probably has their own way of like coping, and steps and organizations and discipline. So uh, we're gonna talk about that in a bit, but let's go ahead and wrap this.
Yeah, I will. I was just gonna say, thank you for sharing that as well, Richard. I could not imagine how difficult it is to be a therapist or to be, training to be a therapist. And I think every program's hard in its own way, especially a doctorate. Oh my goodness. So I think even if you're not necessarily prescribing things, I think therapists have to be so careful with the words that they say. And it
Yeah.
really is like the words that you're using almost are like prescriptions that you're
Yes.
writing. Because if you say, something that's maybe not what that conversation needed or, isn't quite matched with the patient, like that could lead you astray or lead them astray. And so I think it's super challenging to be a therapist. And I'm not sure it's something I would be good at, but I very much commend you for it. But you're right. I guess we're getting a little carried away. We'll get into it. So,
Thank you. Thank you.
our last question for this section is just what's one book or podcast outside of this one that you think everyone should experience? It's okay to answer like a TV show or a movie as well, honestly. Anything you think.
One podcast that I would recommend to people is On Purpose by Jay Shetty. I listen to it a lot in medical school, and it's nice because he comes out with an episode every week on various topics. I remember the first episode that I actually listened to was one of the episodes with Lily Singh, and she was talking about being you know being a first generation immigrant, navigating her, Canadian slash American identity versus like her parents' background is Indian. So like navigating that, and I just like connected with that so well. And I felt like she was able to put into words what I felt for so long. So I think since then I was kind of hooked on it. I remember there was like a Miranda Care episode where she was talking about her like whatever company she was launching, but one thing she said, like one of her advice is like, if you're going to do something, go after it with all your heart, otherwise don't do it. And I was like, wow, like, I don't know, that like really spoke to me as well. So I think there's always like these little pearls that come from each episode, and some of the episodes are better than others, I'm not gonna lie, but I think as you scroll through the episodes you can kind of see like it's a lot of different celebrities, a lot of different topics, and you can kind of pick what's nice for you. It's a nice little podcast to listen to like in the morning when you're getting ready and stuff like that.
I will definitely be checking it out. Thank you so much for the recommendation. That's a wrap for our interview. For our next segment, Bright Talk, where we discuss a complicated topic in hopes of shining light on the matter. This week, we will be discussing day-to-day of an OBGYN resident.
So I guess to start off with, and I know we've been kind of picking your mind already about being an OBGYN resident, but let's take it back to your first day of residency. Can you tell us a little bit about it, what it was like?
Yeah, it was crazy. I started off on ambulatory, which meant that I was covering all of our like multiple different outpatient clinics. And our first day, the day before I tried to prepare for all the patients and etc. But I had like 16 people on my schedule, like 8 in the
I
morning.
remember that.
Yeah,
You're telling me and I was like, what?
8 in the morning and 8 in the afternoon, and I was like, what is happening right now? So I think it was just, and it's also like you're just so used to just going in, seeing a patient, getting the history, and then going to the supervising doctor, being like, this is all the information I have. Now what do I do? And it was like the next step of it was like, this is my plan for this patient. And it was just so weird to be in that new role. I remember stumbling on how to introduce myself to patients. I like felt weird saying, "Hi, I'm Dr. Arza." So then I would like say my whole name, and then that felt weird. And so I just like was even just practicing how to introduce myself to patients was weird. So like it's just kind of surreal, thinking about it. And then like, OBGYN, and we're just constantly doing different procedures in the outpatient setting as well, such as like IUDs and Nexplanons and things like that. So that was exciting to be able to do those things, but it's also like, oh, I'm like really doing this. Like this is really happening. So it was surreal. It was overwhelming. It was a lot, but it was exciting. Like I remember looking back, I remember like coming home and I was just drained. I was exhausted and I was just like, man, this is gonna be a journey.
I just love how you expressed the entire story. I feel like I was envisioning all of it. Thank you for sharing that. So what is your day to day now?
Yeah, day to day, every day, like we rotate through different specialties of OBGYN. So most recently I was on REI, which is reproductive endocrinology and infertility. So it's more like IVF and things like that. So that is a little bit different because I would present to like an outpatient clinic where I worked with the doctors. I would do a lot of like transvaginal ultrasounds and get practice, things like that. Next, I'm starting my family planning rotation. So that'll be very different. I'll be seeing patients in the clinic, doing things like contraception counseling, but also providing care at like our it's a place called Whole Women's Health. So I think it'll be a different type of care, that I'll be providing. So oftentimes other days I'm on labor and delivery, working with, laboring patients and doing C-sections, delivering babies. Other days I'm in gynecology ORs doing things like hysterectomies or hysteroscopy. So every day is kind of different, which is why I love OBGYN. And it's exciting, but a lot of things to learn.
Yeah, I could imagine having to put yourself in so many different environments and having to adapt. You never know like what your schedule will look like. But in terms of patients, like how many patients would you say you see d daily? Or is it more or less like your first day or has it settled?
Yeah, I would say in clinic, we typically see probably around 16 to 20 patients per day. That's what I would say would be standard in clinic. On labor and delivery and things like that, it just varies depending on, you know, who's in
Wow.
labor, things like that.
Yeah. Yeah, just to like a little comparison, for therapy, like part-time, it's like 15 to 20 clients a week. So y'all are
Wow,
doing like
really?
daily, yeah, y'all are
Yeah.
doing daily, what most therapists do part-time weekly.
Yeah,
But
it's really a lot. It's a lot to balance, and it's really hard because you want to be able to give all the patients all the like, all the time in the world because, you want to address every single concern, especially because it takes time to, come in and see a physician and things like that. But it's also balancing, you have all these other patients you have to see as well. So it's a balancing act.
yeah, definitely.
You talked a little bit about the procedures, and I know you like procedures, just knowing you. What do you think the most complicated one that you've done has been, or if I know they're all kind of complex, so maybe the most interesting.
Yeah. I'll talk about two. I love doing C-sections. That's literally the reason why I went into OBGYN was for the C-sections, but they can be quite complicated, especially depending on the indication for them and things like that. And it can be really scary. You're operating on a patient that's alive. I mean, not alive, awake, awake.
Oh
I hope
yeah.
everyone's operating on patients that are alive, awake. So that's another, yeah, that's another level of difficulty. But it's also crazy. You have this, you're going in and there's babies on the inside and you're done and the baby's on the outside. It's just crazy to think about. So I think those can be really fun, but also really scary. Most recently, I was involved in a vaginal hysterectomy, which was very complex in a way because it was just new to me. But it was also amazing that we're able to perform this like major surgery without any abdominal incisions at all. You're doing everything through the vagina. So it's honestly amazing. And I hope to be able to do that in the future for my patients. Vaginal hysterectomies are actually like the recommended way by our governing body, ACOG, to do hysterectomies. But not everyone in everywhere is trained in them. So we often aren't able to do it. So I would feel really excited to be able to provide that to my patients in the future.
Awesome. I'm excited for your journey and I'm excited for all the things that you're going to learn. You're definitely going to be able to save a lot of lives. The things that you are wanting to focus on, like I think it's you mentioned PCOS. Is that what
Mhm.
it's called?
Yes.
Yeah, a lot of people, if I'm not mistaken, suffer from that and don't even know it. What do you have any stats like that come to mind of like how often it is in women?
It seems to be that PCOS, the prevalence kind of varies depending on where you are in the world and things like that. Online, I think it'll say about like 5 to 20% ish, but really, a lot of cases go undiagnosed and it has a different prevalence in different populations, ethnicities. So it's one of those things where for some, and it's just like a wide spectrum of disease, and that some patients are affected more than others by the consequences of it, whether that be like things like infertility and things like that. Most people end up finding out because they have issues with fertility, and that's when they're diagnosed. But and some people don't, and it never really faces a big issue for them in their life. So it's one of those things that because it has such a wide variety of presentation, sometimes the diagnosis can be challenging.
You're kind of brushing on some of the obstacles that patients do face, particularly people with PCOS. What other kinds of obstacles have you seen your patients facing primarily?
I think access to healthcare. We talk about this a lot at work. It's because our volume has increased tremendously over the past year, so much to the point where we think we need extra people to be on call and things like that. And it's because a lot of the hospitals around the area around in Virginia are closing. There's just no more obstetrics units. So if somebody needs to have a baby, they need to come to where we are practicing because there's just no other options for them. So I think
Wow.
that's scary to think about, to not have access to like care that you need to have like a safe and healthy delivery. I think it's terrifying. But it's a huge obstacle. We have patients who travel 2 to 3 hours to get to us, which is fine when everything is fine. But like if you're in an emergent situation,
Yeah.
2 to 3 hours can be, a life and death type of situation. So I think that is really hard. And it's always like counseling patients because they're like, when should I come in? And it's like you don't want to just tell them to come in willy-nilly because you need to respect that, they can't, but also you don't want to, underdiagnose something because, they need to travel far distances. So once again, it's a balance of, realizing your patients like access and needs and respecting those while also being able to provide them the best healthcare.
I'm glad that we're talking about these topics because it puts into perspective what doctors are facing during the current climate and what mothers are facing and what possible scenarios there are. And it really goes into the next question. So like, what are some resources you suggest or provide to your patients to better navigate these circumstances or situations that they have.
Yeah. I mean, I think first and foremost, patients should ask questions to their doctors. I think it's also nice that we have so much information available, online so that patients can feel empowered to read about things on their own. One particular resource I like to use are I briefly touched on it, but ACOG, which is the American College of Obstetrics and Gynecologists, they have a lot of patient information, like frequently asked questions and things like that. So I think providing that resource to patients is really nice, because sometimes it's like, okay, yeah, I want to ask questions, but what do I ask? So like, they touch on a lot of different things that, you can expand upon with like your treating providers. So I think it's important to have open conversations, but also to do your own research. One thing I always caution my patients about is, social media. I think social media has been good in that people have been able to have open and honest discussions, but I think there's also a lot of misinformation out there. So I think counseling people on, people will share their experiences online, which is great, but always like, this may not be your experience just because they had that experience.
Valid. Yeah, very valid.
The part with the questions as well, I could see being particularly helpful for people who are traveling far distances, because it might help them get the most out of the time that they do have with you, because they've already potentially read about, something, or even if they haven't, they might have a better, idea of what questions they want to ask you when they're there.
Thank you so much for such a wonderful interview and Bright Talk segment. It was incredibly insightful, and I had a lot of fun. Despite, talking about very complicated topics, very difficult topics. Thank you. And that's a wrap for the second episode of season 2 of Project Brightside.
Thanks for tuning in and supporting us. Make sure to recommend our podcast to your friends and family. We have a lot more amazing stuff planned for season 2, so make sure to keep sharing. Until next time, take care.
Episode 2 of Season 2 of Project Brightside was executive produced by
Shelby Floor and Richard Brito, Luke Riosti, John Scrivenich, Jake Riosti, Sofia Paez, Andres Gil Arana, and Zoe Rushetsky. Music by Jake Riosti. Edited by Luke Riosti and Richard Brito. And a special thanks to Dr. Shivani Arza.
Thank you for having me.
Thank you. Have a good one. Take care, everyone.